Hey all, Dr. John here. Welcome to our training on the business side of the aesthetic and wellness consultation. In the hospital or at the bedside, when we see patients, we are trained to follow orders and treat the primary complaint. But when you step into an aesthetics or wellness clinic, your role changes. You are no longer just a nurse. You are a clinical authority, a personal wellness advocate, and yes, a business owner. One of the biggest hurdles I see for talented providers is the sales conversation. Many of you feel a bit of imposter syndrome, or you feel like taking their money and bundling services somehow diminishes the quality of your care. I'm here to tell you the opposite is true. In this course, we're going to break down the consultation to a clear, repeatable framework. We're going to move away from being reactive and start being proactive. We will start by exploring the good, better, and best model. You're going to learn how to identify when a patient needs a simple solution versus when they need a total holistic roadmap. We will also talk about why the best method, which looks at the patient as a whole, their energy, their metabolic health, and their skin, is actually the highest form of patient care you can provide. We're also going to tackle the psychological side of the business. We will discuss wallet bias and why you must stop spending the patient's money for them. You will learn the power of the clinical pause and how to use silence to maintain your authority. We will even go over specific techniques like the mirror exercise to ensure the patient is the one driving the conversation about their own goals. From a business perspective, we're going to look at the math of the chair. You're going to learn why bundling services like talks with shots or skin resurfacing is not just about a discount. It's about maximizing your time and delivering a complete protocol that actually works. We want to move away from the coupon shopper mindset and focus on building superfans who are loyal to your expertise, not just your price point. Finally, we're going to talk about confidence. Many of you are new to this, and that is okay. I'm going to teach you how to borrow authority through what we call the collaborative bridge. You're going to learn how to consult with your medical director in a way that makes the patient feel safer rather than making you look like you don't know the answer. By the end of this course, you're going to have the tools to walk into every room with the plan. You will understand how to turn a simple forehead treatment into a long-term wellness journey. You won't just be an injector. You will be the provider that your patients can't live without. So let's get started. This module is about your identity. Before you even touch a syringe or open a vial, you have to decide who you are in that room. Are you a task taker or are you the expert? Confidence starts with your physical presence. In a clinical setting, we are often rushing between rooms, standing over patients, while we check vitals. In aesthetics, that creates a power imbalance that the patient's going to feel. And it's going to feel like that they're on an assembly line. The very first rule is the eye level rule. When you are doing your assessment, do not stand over your patient. Oftentimes in the hospital, where are you? The patient's in bed, you're standing up high and you're looking down on them. We don't want that here. This signals that you are in partnership with them when you're at eye level. It creates this space for a real conversation rather than a lecture. Watch your hands. Notice how I'm waving my hands all the time? Fidgeting with your tablet or clicking your pen tells the patient you're nervous. If you are nervous, they're going to be nervous. Keep your posture open and your movements deliberate. If you look like you would have all the time in the world for them, they will trust you with their most vulnerable concerns. The words you choose can either build a bridge of trust or dig a hole of doubt. New providers often use what I call hedging language. They use words like just, maybe, sort of, or I think. When you say things like, I think maybe we could just do a little talks here, you're telling the patient you aren't sure. You're asking them for permission to be the expert, not the other way around. So we're going to strike those words from our vocabulary. Instead of I think maybe, you should say, hey, my clinical recommendation is. Instead of we could just do a little, you could say, hey, the protocol for your goals is. Authority is not about being bossy, it's about being clear. Clarity is a gift that you can give your patient. I know many of you are worried about the moment a patient asks a question you can't answer. Your instinct might be to say, I don't know, I'll have to ask. The second you say those words, the patient stops looking at you as a provider and starts looking at you as an assistant. Instead, we use the collaborative bridge. So what's a collaborative bridge? If you need to check something with your medical director, you say, hey, that's a great question. Because every face is unique, I want to collaborate with my medical director on your specific anatomy to ensure we hit the exact mark. I'll have that confirmation for you before we start. See, what we did, we just bridged doubt into a surety. You haven't admitted a weakness at this point. You've highlighted a strength that you belong to a skilled clinical team that prioritizes their safety above everything else. Now let's talk wallet bias. This is perhaps the hardest part for nurses. I know I had a problem with it. We as nurses are empathetic by nature. We don't want to burden people with high costs. This leads to what we call wallet bias, where you decide what a patient can afford before they even tell you. If you only offer the good plan because you're afraid of the best plan is too expensive, you're actually being unethical. You're making a medical decision for that patient without giving them all the facts. Your job is to provide the best clinical roadmap for the results they want. Their job is to decide how to pay for it. Don't spend the patient's money for them. When you hold back a recommendation, you aren't being nice, you are withholding a solution. So take off the caregiver hat for a moment and put on the advocate hat. An advocate tells the truth about what is needed to reach the goal, not omitting facts. Now that your mindset is right, let's talk about the moment your patient walks through the door. The first 5 minutes of any consult, they are the most critical. This is where you move from being a stranger to being a trusted partner. Leading with the why. Most providers start a consultation by asking, "What can I do for you today?" This usually gets a one-word answer like Botox. To build a holistic plan, we need a bit more context, but we want to keep it light and natural. Instead of a deep philosophical question, try a multiple choice approach. You might say something like, "Well, I'm glad you're here. To help me give you the best recommendation, tell me, do you have a big event coming up, like a wedding or a vacation? Or do you just wake up one morning and decide, hey, it's finally time for a refresh?" This is a much easier question for a patient to answer. If they say, "Actually, I have a class reunion in 1 month," you now have a deadline and a goal. If they say, "I just saw a photo of myself and I realized I look tired," you have your clinical mission to make them look rested. When you know the context, you're no longer just selling units, you're helping them prepare for an event or fix a specific frustration. This makes your recommendations feel like a solution rather than a sales pitch. There is a deep psychological rule called reciprocity. When someone gives us something of value for free, we feel a natural subconscious need to return the favor. In a consultation, this creates a yes environment. So the goal is to provide a high value extra before you ever ask for the sell. This could be a professional grade skin analysis or a specific sample of a medical grade serum, that might fit with their unique skin type. It could also be as simple as offering them a water or beverage when they arrive. By giving them your time and expertise upfront without a price tag, the patient feels cared for. They are much more likely to follow your larger, better, or best recommendations later because you have already invested in them. As a nurse, you have a unique advantage. You are a medical expert, but you are also seen as a peer. Patients are often nervous that they will look fake or that they are the only ones struggling with a certain issue. You can fix this with social proof. Tell stories. Use the phrase, "Oh, I know what you mean. I had a patient last week who was feeling the exact same way." Or, "My spouse feels that exact same way." Here's another example. I had a patient last week who was feeling that same lack of energy. We decided to pair her tox with a vitamin B12 shot with the vitamin D boost in there as well. She told me later it was the first time in months she did not feel that 3 p.m. crash, right? We just bundled it together. So what did you do? This normalizes the treatment. It tells the patient that people just like them are doing this every day. It makes the holistic approach feel like the standard of care rather than an upsell. The final part of connection is making sure the patient feels heard. The easiest way to do this is through mirroring. So, what's mirroring? When you summarize the treatment plan, repeat their specific words back to them. If the patient says they feel gray and tired, you do not want to tell them you will brighten their complexion. Use their words. Say, "Our goal today is to address that gray and tired feeling by getting your youthful glow back." We just mirrored what they said, right? When a patient hears their own words coming out of your mouth, their brain signals that they are safe. They feel understood. And once they feel understood, they're going to trust you to lead them towards the best version of themselves. So let's summarize what we just learned. Find the why. Look for the emotion, not the area. Give first. Trigger reciprocity with a small favor. Use social proof. Share relatable success stories. This is a great place for before and after photos, right? And then use mirror language. Use their own words to prove that you are listening. Do all that, and you're on your way to a great consultation. In this module, we're going to cover the heart of the consultation. We are moving from the initial connection and discovery phase into the physical assessment and the presentation of your clinical plan. As a nurse, this is where your expertise is most visible to the patient. You're about to take everything they told you in the first 5 minutes and translate it into a professional roadmap. We're going to dive deep into two major concepts: the physical assessment through the mirror exercise and the choice architecture of the good, better, and best framework. This module is designed to give you the clinical and psychological tools to lead a patient towards the results they actually want, even if they do not yet know how to ask for them. So once you have established a rapport with your patient, it is time to transition to the physical exam. But we're not going to start by telling the patient what we see. We're going to start by letting them tell us what they see. This is done through a tool we call the mirror exercise. All right. And I'm not talking about mirroring their language here. I'm actually talking about getting a physical mirror out. By using a handheld mirror, you're going to change the perspective. Physically hand the mirror to the patient. In psychology, this is called the endowment effect. When a person physically holds an object, they feel a sense of ownership over the situation. By handing them the mirror, you're going to give them the driver's seat in their own assessment. This lowers their defenses because they do not feel like they are being scrutinized by an outsider. Why? They're looking at themselves. They feel like they are in a collaborative session with the provider as a partner. Once they have the mirror, try this prompt. When you look in the mirror today, what is the very first thing that catches your eye? This question is intently open-ended. If you ask, what do you want to fix? It implies something is broken. If you ask, what catches your eye or what bothers you? It allows them to point out a concern without feeling judged. Now, here is where we separate the average injector from the elite aesthetics and wellness nurse. While the patient is looking in that mirror at their fine lines, let's say, you're going to be looking for systemic clues. The skin is the largest organ of the body, and it is a direct reflection of internal health. As a wellness-focused nurse, you're looking for internal markers of the external canvas. If you see dark circles underneath the eyes, you might be thinking about filler. You're also thinking about maybe adrenal fatigue or sleep apnea, maybe some iron deficiencies or poor sleep hygiene. If you see adult acne or localized redness, you're not just thinking about a pill. You're thinking about systemic inflammation, maybe gut health, things of that nature. Now, while they are holding the mirror, this is your opening to pivot to wellness. You might say, hey, I see this area you're talking about, but while I'm looking at your skin, I'm also noticing a bit of dullness and some shadowing underneath the eyes. As a nurse, that tells me your body might be working overtime internally. Tell me, how has your energy been feeling lately? Are you waking up feeling rested, or are you hitting a wall in the afternoon? Now, this is a powerful transition. You are connecting their aesthetic frustration to their metabolic reality. If a patient is struggling with weight, high cortisol, or insulin resistance, their aesthetic results will never be optimal. Chronic inflammation breaks down collagen faster than we can build it, that's for sure. So by identifying these wellness markers during the assessment, you justify the best method before you even present it. You're teaching them that glowy skin isn't just a product, it's a metabolic state. This allows you to naturally introduce skin products, maybe some GLP-1s, some peptides, or IV hydration as essential components for their beauty protocol. Let's shift gears to the good, better, best framework. Now that the assessment is done, you have to present the plan. Many new providers make the mistake of presenting only one option, or even worse, presenting 10 different options that overwhelm the patient. Here we use choice architecture, specifically the rule of three. When people are given three choices, they feel empowered but not overwhelmed. They almost always gravitate towards the middle option, which is exactly where you want them. So let's break down how to present these three pillars deeply and effectively. The good method is the baseline. It is treating a specific area the patient pointed out. If they come for forehead lines, the good method is talks for the forehead. When you present this, you might explain the limitations. You might say, hey, our plan is to treat your forehead lines directly with neurotoxins today. And this is a fantastic start. It will soften those dynamic lines and give you a more rested look. However, this is a targeted fix. It addresses the muscle, but it doesn't address the overall health of your skin or your internal wellness. When you frame it this way, you're not being negative. You are being honest. You're letting them know that while this will help, it's only one piece of the puzzle. The better method is where you bridge aesthetics to skin quality. You're treating the muscle with tox, but you're also treating the canvas of the skin. You might say, hey, this plan involves treating lines with tox, but also scheduling a skin resurfacing session like microneedling or CO2 laser. When we treat the muscle and the skin together, your results are going to look much more natural. And guess what? They're going to last longer. So then you can shift into maybe talking about clinical studies. You could say something like, hey, clinical studies show that healthy, hydrated skin actually holds on to aesthetic treatments better. By recommending a better plan, you're just ensuring the patient gets a higher return on their investment. You're moving away from a single transaction to a professional skin protocol. All right, so that's the better method. Now let's switch and talk about the best method. The best method is where you truly step into your role as a wellness nurse. This is the inside out approach. You're looking at the patient's lines, their skin, and their systemic health. This is where you bring in the discovery work you did in module 2. If patient mentioned that they feel tired, run down, maybe they've lost their glow, the best method is the only one that truly solves their problem. So the script for the best method sounds something like this. Based on everything we've discussed, my professional recommendation for you is our holistic roadmap. This is our best plan because it addresses every layer of your aging process. We will treat the lines today with tox. We will set up a monthly skin health protocol with microneedling and medical grade skincare to fix the texture. But most importantly, we're going to look at you and your internal wellness. You mentioned you have been feeling low on energy. So I'm going to recommend that we're going to incorporate vitamin B12 infusions and vitamin D shots and schedule a separate consultation to look at your metabolic health and see if you are a good candidate for our wellness or maybe our GLP-1 programs, something like that. When we fix the inside, the results on the outside are exponentially better. You won't just look younger, you're going to feel younger too. So this is not a sales pitch. This is clinical prescription for their health. When you present the best method with confidence, what are you doing? You're acting as their advocate. What happens when a patient is hesitant? Perhaps they are worried about the cost of the commitment of a best plan. This is where you must understand the psychological principle of loss aversion. Research has shown us that humans are twice as motivated to avoid a loss as they are to achieve a gain. In aesthetics, the patient is currently losing collagen, losing skin elasticity, losing metabolic efficiency every day. Patients don't want to lose anything. If they want to stay with the good plan when you know that they need the best plan, you must explain the cost of inaction. So you might say something along the lines of, hey, I completely understand wanting to start slow. However, it's my job to make sure you know that if we only treat the muscle and ignore the skin and your internal health, your aging process will continue underneath. Over the next year, your skin will continue to slow its collagen production and your skin health will continue to age. While treating you with tox can help you with your lines and wrinkles, your skin's natural aging will continue. By choosing a more comprehensive plan today, you're actually saving yourself money and protecting the skin you have right now. Okay, so what do we just do? This just shifts the perspective from spending money on a luxury to investing money to prevent a future loss. It is a powerful motivator that helps patients commit to the protocols that will actually give them the results they desire. To wrap up this module, I want you to remember that the assessment is the bridge between a patient's insecurity and your clinical solution. When you use the mirror, you're giving them a voice. When you use the good, better, best framework, you give them a choice. And when you explain the biology of aging through loss aversion, you give them a reason to act. Your confidence in this phase is what determines whether the patient leaves with a single treatment or a lifelong relationship with your practice. Remember, you're the expert, you're the nurse, and you are the one who knows how to get them to the best version of themselves. So in the next module, we're going to talk about the math of the chair and how to physically handle these services so that the best plan becomes a very easy yes for every patient. All right, we have spent the last few modules talking about your mindset, the psychology of the patient, and how to perform a comprehensive clinical assessment. Now, we're going to pull back the curtain and we're going to talk about the numbers. This is where we discuss the math of the chair. As a nurse, you're used to the idea of resource management in a hospital setting. But in a private practice, your time and your chair are your most valuable assets. So in this module, we're going to explore how to structure your services so that you are providing the highest possible value to your patient while maintaining a healthy, profitable business. So we're going to cover fixed costs versus marginal time, the strategy of the anchor and the add-on, and the tactical art of the clinical pause. To understand bundling, you first have to understand the economics of your treatment room. Every single time a patient sits in your chair, there is a fixed cost associated with that visit. This includes the rent for the building, the electricity, the cost of the cleaning supplies, maybe you have employees, maybe you have supplies for the room. But most importantly, we're talking about your time. Whether that patient gets 5 units of tox or a full liquid facelift, those fixed costs remain relatively the same. This is why the first service a patient receives in a visit is always the most expensive for the practice to provide. However, the second and third services you provide during that same appointment are what we call marginal time services. Because the patient is already in the chair, the room is already clean, and the intake forms are already signed, your overhead for a second services drops to almost zero, right? Think about it this way. If a patient comes in for just a B12 shot, you're going to spend 15 minutes on intake prep, charting for a $50 service. But if that patient is already in the chair for a tox treatment and you add that B12 shot on at the end, it takes you exactly 60 seconds of extra work. This is why we can afford to offer better pricing when we bundle. We're not just giving a discount, we are passing the savings of our own efficiency back to the patient. We don't need to charge $50. We can charge $25 and still make a good living. In the world of aesthetics and wellness, we categorize our services into two groups: high demand anchors and high margin add-ons. What do I mean by that? Your anchor services are the things like neurotoxins. These are the most popular procedures in the industry. They are the hook that brings people through the door. However, tox is relatively expensive to buy. Your profit margin on tox is often much lower than other select services because the medication itself has a high cost. Your add-on services are things like vitamin shots, IV hydration, maybe PRF, or medical grade skincare. These are your high margin items. The cost of the actual vitamins or the needles is very low, but the clinical value to the patient, very high. The best method we discussed in Module 3 relies on pairing these two together. When you pair an anchor with an add-on, you are creating a win-win scenario. The patient gets a comprehensive result, the tox for the lines and the B12 for the energy, and your practice sees a much healthier profit margin. As a provider, you should never feel like you are upselling. You are simply optimizing the visit. If a patient is already receiving tox, then they're in the perfect position to receive an IM shot or a chemical pill. You're maximizing the math of the chair, and for not only you, but everyone involved. One of the biggest mistakes new providers make is offering flat discounts, such as 20% off everything today. While this might drive a quick sell, it is a risky business practice to do often. Trust me, I know. Flat discounts devalue your clinical expertise and attract couponers, coupon shoppers, Grouponers, right? And these people, they have no loyalty to your practice. Instead of discounting, we focus on perceived value through bundling. So let's look at B12 example again. A standalone B12 shot might be $50. That price covers your time, the room, the supplies. But you could tell your patient, hey, since you're already in the chair today for tox treatment, let's add a B12 shot and give you a little energy boost for $25. Now, in the patient's mind, they just save 50%. In reality, you made maybe $20 of pure profit for 60 seconds of work. This is much better for the business than a flat discount because the deal is tied to their patronage of a primary service. You can apply the same logic to profit-heavy items like PRF. If you know your margin on PRF is 80 or 90%, you have a lot of wiggle room. A lot of wiggle room to bundle it with a more fixed price item like tox. This allows you to deliver a high value, holistic protocol while still protecting the financial health of your practice. All right, now let's talk about the actual moment you discuss the price. For many nurses, this is the most uncomfortable part of the consultation. You might feel the urge to apologize for the price or immediately offer discount before the patient even asks. This is where we use the clinical pause. Confidence is quiet. When you present your best method recommendation, state the total price clearly and then stop talking. Here's an example of what I mean. Based on our assessment, the best plan for your goals today is 40 units of tox, a B12 energy boost, and your first microneedling session. The total cost for this package protocol is $600. Would you like to get started with that today? Pause. After you ask that question, you must wait for the response. Do not fill the silence with, but we could do it cheaper, or, hey, I know that's a lot. That silence is a tool of authority. It gives the patient space to process the value you have just spent the last 20 minutes explaining. If they have a price objection, refer back to your good, better, best framework. You can say, I completely understand. That is our best plan, and I understand this is a significant investment in your long-term health. But if that doesn't fit the budget today, let's start off with the good plan for $400 and we could just look at adding the other treatments as you are ready. Does that sound good? Silence. By doing this, you have maintained the value of your services. You haven't dropped your price. You have just simply adjusted the scope of the work. This keeps you in the role of the professional provider rather than a salesperson who is just haggling. The final piece of the business puzzle is documentation. I cannot stress enough how important it is you use your EMR to track more than just clinical notes. Every time you have a consultation, you should be writing down the future goals of that patient. If they mention they want to look great for a wedding in 6 months, that needs to be in the notes. They mentioned that they are interested in GLP-1s but weren't ready to start today. That needs to be in the notes. This allows you to reopen that business conversation at their next visit. Instead of starting from scratch, you could say, hey, last time you talked, you were interested in your metabolic health and our metabolic health program. Is that something you'd like to dive deeper in today? Silence. What did you just do? You just created a continuity of care, and that makes the patient feel like they are on a long-term journey with you. It turns a one-time transaction into a lifetime relationship. Here's a quick tip. I also jot down any information on what they have been up to, like future trips or other details that I can revisit at the next appointment. This helps maintain a strong relationship. It keeps them coming back to a friendly and familiar practice, even if they are able to find the service cheaper somewhere else. So for instance, I'll put a note down that says, hey, how's that new grandbaby doing? She's what, 6 months old now? Always be off by a month. They're like, no, 7, but geez, I can't believe you remembered, right? Well, you didn't remember, you wrote it down in their chart, okay? But it keeps you interested in them as a person other than them just being a cell. All right, so let's sum this all up. This is the summary for providers. Understand fixed costs. Every minute in the chair has a cost. Maximize it with multiple services. Pair anchors and add-ons. Use high demand services like talks to introduce high profit wellness services. Sell protocols, not discounts. Focus on the value of a complete plan rather than a lower price. Master the clinical pause. State your price with confidence and then let the patient respond. Use the EMR for future growth. Document their next steps, their goals. That way you're always prepared for the next consultation. Do these things and you're on the road to being an excellent provider and you're going to make a lot of money in the process. At this point in the course, we have covered the mindset, the assessment, and the immediate math of a single visit. But a successful practice is not built on a one-time transaction. It is built on relationships and long-term results. So in this module, we're going to talk about protecting your practice. We will explore why traditional discounting can actually hurt your clinical outcomes, how to use packages to ensure your patients get the results that they deserve, and the math behind turning a first-time patient into a super fan who refers their entire circle to you. Let's talk about the coupon shopper trap. As nurses, our instinct is to be helpful and accommodating. When a patient asks for a deal, we want to say, yeah, because we want them to feel good. However, there's a significant difference between loyal patient and a coupon shopper. A coupon shopper is someone who chooses a provider based on solely on the price. They are looking for the flash sale or the Groupon. The problem with those clients is twofold. First, they have zero loyalty. Trust me, I know. If the clinic down the street drops their price by $5, that patient is gone. Second, and most importantly for you as the clinician, coupon shoppers often have the worst clinical outcomes. Why? Because they rarely commit to a full protocol. They might get the good plan today because it was on sale, but they will skip the better or best steps because there wasn't a coupon for them. When their results don't look perfect because they only did half the work, they don't blame the lack of a protocol or their finances. They blame you. Protecting the practice means protecting your reputation. By avoiding flat discounts and instead focusing on value-based pricing, you're going to attract patients who value your hands, your eyes, and your medical judgment. You want patients who are invested in their journey, not just looking for a bargain. The most effective way to avoid the discount trap while still giving your patients a sense of value is through packaging. Think of a package as a clinical contract. When you sell a single session of microneedling, you're selling an appointment. But when you sell a package of 3 sessions plus a post-care kit, you're selling a result. As a nurse, you know that biological change takes time. Collagen does not rebuild overnight. Metabolic health does not reset with one injection. By packaging your services, you're ensuring that the patient stays under your care long enough for you to actually deliver the best outcome. When presenting a package, focus on the protocol value. An example script. Hey, I want to make sure you get the absolute best results for your skin. For your goals, a single session is not going to be enough. My clinical recommendation is our GLOW protocol. This includes 3 microneedling sessions and your medical grade home care. By bundling these together, we're going to ensure your skin is supported every step of the way, and we're able to provide the home care products at no additional cost as part of the package. Notice that you didn't say the word discount, you said additional costs. This frames the value as an inclusion rather than a price drop. Your most valuable marketing tool is not an Instagram ad or Instagram post. It is a happy patient. In this industry, we thrive on superfans. These are patients who don't just come back, they become your advocates. To build a pool of superfans, you're going to need to understand loyalty math. It is 5 to 10 times more expensive to acquire a new patient than it is to keep an existing one. Therefore, our discount should be reserved for those who have already proven their loyalty or who bring life into the practice. So consider a referral program that rewards both parties. So what would the script look like? Hey, I've loved working with you on your wellness journey. Most of my patients come from word of mouth. If you have a friend or family member who you think would benefit from what we're doing here, please send them my way. And when they book their first treatment, I'm going to put a $50 credit on your account as a thank you. And they will get $25 off their first visit as a welcome gift. Or for every 2 patients you send my way, your next tox injection's on me. What did we just do? This creates a viral loop. People are referred by a friend, are more likely to be high quality, loyal patients because they already trust you by proxy. You are rewarding their behavior that grows the business rather than rewarding someone just for asking for a lower price. One of the most powerful arguments against shopping around for deals is continuity of care. This is a concept we understand deeply in the hospital, but it is equally vital in aesthetics and wellness. Every injector has a different artistic hand. Every patient has a different biological response. When a patient jumps from clinic to clinic chasing deals, they're putting their safety at risk. They end up with a mismatch of products, different depths of injections, and no single provider who truly knows their baseline. You should communicate this to your patients as a matter of professional pride. What's an example script? One of the reasons I want to see you back in my chair is for your safety and consistency. I have documented exactly how your muscles reacted to this dose and how your skin responded to this depth. When we stay on this journey together, I'm going to be able to fine-tune your treatments for a result that is uniquely yours. Jumping between different providers makes it very difficult to achieve that high-level natural look that you and I are looking for. So by framing your loyalty as a safety and quality standard, you move the conversation away from how much it is to, hey, who do I trust with my face and my health, right? So how are we going to build that super fan experience? Use your EMR to remember details. If they mention their daughter's wedding, ask how it went at the next visit. Every now and then give your loyal patients something small and unexpected, a free B12 shot on their birthday or sample of a new product. Just because I thought of you. Creates a deeper emotional bond that any coupon could ever. Continue to educate them. Send them a quick text or email about a new study on NAD or a skin tip that you'd like them to know. When you treat your patients like a community rather than a list of appointments, they're going to protect your practice for you. They will defend your prices to their friends because they know the value of the person behind the syringe. All right, we have covered the mindset, the assessment, the math, and the loyalty. Now we're at the finish line, the close. In a clinical setting, we are often focused on the discharge. We want to get the patient safely out the door. But in aesthetics and wellness, the end of the visit is actually the beginning of the next phase of their journey. A successful consultation does not end when the patient pays their bill. It ends when they know exactly when they are coming back and what they have to look forward to. In this module, we're going to cover the 2-week vision, the necessity of the mandatory follow-up, and the tactical execution of the calendar close. The moments immediately following a treatment are when a patient is often the most vulnerable. They might have a little redness, a tiny bit of swelling, or they just might be nervous about whether they made the right choice. This is where you must step in and paint the 2-week vision. The 2-week vision is a psychological tool used to build anticipatory joy. Instead of focusing on the post-care instructions alone, you want to describe the future state of the results. So example script. Hey, now that we're finished, I want you to know exactly what to expect over the next 14 days. Around day 5, you're going to notice those forehead lines start to soften. But by day 10, you're going to wake up and realize you look much more rested. In 2 weeks, you're going to come back and we are going to look at your before photos together and you're going to be absolutely amazed about how much brighter and more refreshed you're going to look. We will also discuss at that time your results and make any adjustments for your particular anatomy moving forward. This way we have a highly tailored protocol specifically for you. One of the most common mistakes new injectors make is telling a patient, hey, call me if you need anything or if you want a touch up. This is a reactive approach that leaves the success of the treatment in the patient's hands. As a professional, you should never make the follow-up optional. It is a mandatory safety and quality check. So what's the script look like? Hey, in my practice, we don't do one and done treatments. I want to follow up in exactly 14 days for a quick check-in, even if it's just over text messages. This is not just a need a touch-up visit. It is part of your clinical protocol. Every face is unique, and I want to see exactly how your muscles responded to our dosing a day. This allows me to fine-tune your roadmap and ensure your results are perfect. It's going to be how I guarantee the high standard of care you expect from me. Now, when you frame it that way, the patient doesn't feel like you're treating them just once. They feel like you are being a responsible, detail-oriented provider who plans to continue their care past their first appointment and well into the future. This builds immense trust and significantly reduces the chance that they're going to go to another clinic for their next treatment. The final most important business step is the calendar close. You should never let a patient leave your chair with the phrase, hey, I'll call you to reschedule. In our world, I'll call you usually means I will forget until I see a wrinkle in 4 months, and then I will book with whomever has an opening on a Saturday. To protect the patient's result and your practice's schedule, you must book the next appointment before they leave the room. So what's the example script? Hey, to ensure we keep you on track with your aesthetics and wellness plans, let's look at the calendar right now. I'm going to be touching base with you in 2 weeks for your check-in, and then we should look at 90 days out for your next maintenance session. Does that same time on a Tuesday work for you? I want to make sure you have the preferred slot before my schedule fills up. This is not being pushy. This is organized care. Just like a dentist pre-books a 6-month cleaning, you're pre-booking their aesthetics and wellness maintenance. This is going to ensure continuity of care and creates a predictable revenue engine for your business. If your patient is on the best method plan that includes wellness or metabolic health, the close is the time to reinforce their internal goals. Example script. I'm so excited for the work we did today. While we wait for the talks to kick in over the next 2 weeks, I want you to focus on the hydration and sleep goals we discussed. Remember, we're treating you from the inside out. When you come back for your follow-up, we will also check in on how you're feeling on your new supplement protocol. So what do you just do? By bridging the aesthetic results to their wellness habits, you're reminding them that you are more than just an injector. You are their partner in health. You are reinforcing the idea that their beauty is tied to their vitality. So let's summarize. Paint the 2-week vision. Build anticipation by describing their future results. Make follow-ups mandatory. Frame the check-in as a safety and quality standard, even if it's just a text message in a few weeks. Execute the calendar close. Never let a patient leave without their next appointment booked. Close the wellness loop. Remind them of their internal goals and habits. This concludes the didactic portion of our course. Below this video is a cheat sheet for you to download and print out. And this is a great tool to quickly go over prior to a consultation to refresh your memory. You now have a complete framework for what I believe is a world-class consultation. You have the mindset of an expert, the tools of a psychologist, and the roadmap of a wellness advocate. Now, implement it in your practice and make it yours. At this point, you're probably wondering, this is great for new patients, but how do I do this with someone I've been seeing for years? Won't it feel like I'm suddenly trying to sell them something? The short answer is no. If you frame it as a clinical reset, you are actually in an advantage with existing patients because you already have a rapport and trust built with them, okay? In this addendum, we're going to cover how to move a legacy patient from a single service routine into a holistic roadmap, okay? Let's talk about the standard of care update. The most natural way to transition an existing patient is to cite a change in the practice professional standards. You aren't changing the relationship. You're updating protocol to provide better results. So what does that script look like? Oh, Sally, it's so good to see you again. Before we get started with your regular treatment today, I want to do something a little different. I've worked with my medical director recently and updated my clinical standards to be more holistic. I want to take 5 minutes to do a fresh assessment of your goals from your skin health to your internal wellness to make sure that plan we started a year ago is still the best one for you where we are today, okay? And what did I do? I just called it a clinical update. I removed all that awkwardness. You're now showing them that you're committed to staying on their cutting edge of their care, right? Now let's talk about bridging the gap. For your repeat tox patients, the transition to wellness is usually built on the tired or glow conversation. You've seen their face every 3 months for the last several years. You know what their patterns are. So what does the script look like? Hey, we've been doing a great job managing your forehead lines over the past few visits. But as your nurse, I've been looking at your overall skin brightness lately. I noticed you mentioned last time that your work schedule has been a lot more stressful. Have you noticed that affecting your energy or your skin's glow? I'd love to show you how pairing your talks with some metabolic support or IV hydration can actually make these results last longer and get you feeling better internally. Right? What do we just do? We're bridging the gap, right? You are using their history to justify the new recommendation. You aren't upselling, you're optimizing based off their specific life stressors. Okay? Bridging the gap IV to aesthetics. For your IV therapy or wellness clients, the bridge goes the other way. They already trust you with their internal health. Now you're connecting it to their external experience. So, what does that script look like? Sally, you've been so consistent with your IV protocols, and I can see the difference in your hydration and energy levels. But I'm curious, since we are working so hard on your internal health, have you thought about how to reflect that on the outside? Usually, when people feel good, as you do now, they want their skin to match that energy. While you're in the chair today, do you want to do a quick mirror assessment to see how we can brighten up your skin to match your internal health? Okay, it's as easy as that. Now let's talk about the good, better, best reset. Even with an old client, you can reintroduce the three pillars. What does that script look like? Hey, Sally, we've been doing what I call the good plan for a while now, and it's working well for your lines. But I wouldn't be doing my job if I didn't tell you about my better and best options that I've seen incredible results with some of my patients recently. Since you're already here, can I walk you through what a 90-day roadmap would look like for you? It might save you some visits in the long run and give you a more comprehensive result. Right? We just shifted the conversation. They'll never say no to that. All right, so now let's use the EMR to close the loop. This is where your notes from previous visits and the relationship you've garnered over the years becomes your greatest asset. Use a specific detail they mentioned 6 months ago to open the door today. So what does that script look like? Sally, I was looking back at my notes from last summer, and you mentioned you were really struggling with sleep and feeling a bit washed out. We didn't have our current wellness protocols back then, but we do now. And I'd love to revisit that conversation and see if you can come in and add some vitamin D or NAD to your treatment today to finally address that fatigue we've talked about. Okay. So let's put that all in summary for transitioning patients. Frame it as an update. Use terms like standard of care language so it feels like a professional improvement. Use their history, reference their past complaints, fatigue, dull skin, to justify a new best plan. And then bridge that gap. Connect their current service of IV or tox to its natural counterpart in either aesthetics or wellness. That annual reset, treat every fourth or fifth visit as a brand new consultation to provide routine fatigue. I will actually, every fourth visit, add another 15 minutes to that. And that keys me in that, hey, I need to do a reset with this patient. Okay. Do this and watch you transition from your existing patient who might just be doing one treatment to the super patient who's doing them all. Hope you learned a few things.